Good morning, good evening, and wherever in whichever part of the world you are. Welcome back to my podcast, Digital Transformation in Healthcare. After a small break, we are back again with one of our esteemed guests, Dr. Nandini. And first of all, thank you to the New World Foundation for sponsoring and supporting this podcast channel. So today's discussion is about generative AI and decision support system in healthcare administration. I'm your host, Fardeen, and as always, we'll explore how technology, intelligence, and innovation are driving the next wave of transformation across healthcare ecosystems, from operations and automations to everything in between. And today's discussion takes us to one of the most exciting and fast paced topics of transformation, which is generative AI and the decision support systems. And for us, I'm delighted to welcome Dr. Nandini K. She is the assistant professor at the Symbiosis Institute of Technology, Pune. Dr. Nandini, welcome to our podcast channel. We are really excited to have you. Dr. Nandini, she specializes in artificial intelligence, machine learning, applications in healthcare and computing. Her academic and professional journey spans over a decade of higher education, and applied research, including roles as postdoctoral researcher at Symbiosis Center of Medical Image Analysis, SCMIA, and as a research associate under SSR Impress Initiative. She holds a PhD in computer science from Bharatiyar University, where her work focused on advancing statistical modeling, deep learning, and medical data analysis. Her research expertise covers text mining, hyperspectral imaging, Python R, and MATLAB with practical applications across data mining, AI-based diagnostic, and decision support system. Her current research focuses on generative AI in healthcare. With this rich multidisciplinary background, Dr. Nandini brings unique insights into how AI, deep learning, and statistical computing can accelerate automation, regulatory intelligence, and large scale transformation in healthcare and payer operations. We are truly honored to have her with us today. And as we explore on the topic on generative AI and how it is defining how decisions are made, information is processed, as well as the values are delivered across the healthcare landscape. Dr. Nandini, welcome to the podcast.
Thank you, Mr. Fadil. It's a very warm and long introduction. Thank you so much for inviting me for this wonderful podcast. Thank you.
Absolutely. Your profile and your research background speaks volumes about your work. So let's start off and the discussion with your favorite topic about the AI and ML. So can you tell us about your research in AI ML and how data science kind of led you towards your interest in applying those knowledge and the technology into healthcare system and administration?
I can say that it is during my postdoc only I started my research. Actually, my research focus shifted from my PhD research work, hyperspectral imaging, to medical imaging. So there, I specifically worked on automated pediatric desegmentation, especially working with MRI and CT images. And there, I realized that the manual segmentation, like complex images, when we try to do the segmentation, it is really time consuming task. Actually, that was I was also doing that task, actually, manual segmentation. And this also affects the diagnostic approaches. A diagnostic time also, it is taking a lot of time when we are working on that segmentation. And that is where the AI, when I try to do that automation through the AI process, automatic segmentation, it is reduce the clinical overload by that time. So, and also it improves the accuracy and also efficiency when I'm working on that. And this is also sparked another curiosity. And how about AI in healthcare administration and system in a whole? How exactly it works? And because when I'm looking into the only images, it's very simple. Just I'm trying to do the segmentation. But when it comes to whole healthcare, That is where the
Mhm.
real challenge and more challenges happening over there in the healthcare, because here the stakeholders like clinicians to patients and policymakers all are involved in this particular one, and how exactly this AI is going to integrate those technologies, that workflows, healthcare critical workflows. So that is where the real challenge that we are all trying to bring in the current scenario. And this also made me more interested to work on the generative AI in healthcare. So that's how my interest and this motivation has begun to start this journey.
Absolutely. Thank you so much for your views on that, and especially from the clinical side to non-clinical healthcare administration, and specifically for us, like who are not, I'll not involve you rather. For me, like someone who is does not have a medical sciences, a direct degree, not a doctor or someone, my interest in healthcare started and kind of got limited towards non-clinical side, so where we have the healthcare systems management, the administration, etc. So that's where it's kind of growing, and there is something like we, and again, nothing to take away from the doctors, the nurses, the frontline care providers. They are the ones who are really helping the society move forward. But typically, we, or what things we don't see in the background are the healthcare administrators who are processing, specifically here in the United States market, where health insurance, and in the European market as well. So we have regulatory guidelines in terms of GDPR, HIPAA, CMS, etc. There is a huge market for healthcare insurance, healthcare administration. So that really takes care about, or kind of focuses how this AI and the advanced technologies, specifically Gen AI, affecting healthcare. So continuing the discussion, so when we talk about Gen AI in healthcare administrative context, again, this question I'll focus on non-clinical aspects. So what according to you look like the most promising use cases? I have had experience in like prior authorization claims. I talked about the policy guidelines, the state and the federal mandated guidelines for healthcare administration. Then you have the regulatory and the compliance issues as well. We have the healthcare insurance companies, the payers, providers, and the physicians contracts. We also deal with a lot of data as well. So,
Yes.
according to you, what do you think are some of the most promising use cases which Gen AI can impact, Gen AI can affect, and Gen AI can help progress and prosper in this landscape?
Okay, so basically, this non-clinical context, whatever you're trying to say, these are all the invisible workload, and also it super suppresses, the work. I mean, it also suppresses the time, and also it will take a lot of time to do everything. So first thing we can talk
Mhm.
about how exactly the Gen AI that can work on that. First is document generation. So one
Mhm.
very good example I can say that I mean initially whatever the report drafting or anything summaries or any communication with different departments that you want to make, just give it to the generative AI. It will make any initial draft. It will give, but the administrators can give a review, and also they can do they can go for decision making kind of, they can do that. And another important thing, as you as suggested, that HIPAA and all the policies and regulations for the HIPAA Act, there are a
Mhm.
lot of government regulations are also there. So how exactly we can, they can consider that one example, if any hospital has to improvise their data privacy regulation, if they want to update, and it has to align with the government policy, and communicating with all the departments and getting the details and then updating, it will take a huge amount of time, and the work amount of work and time they are giving, communicating with the people also, it will take a time. So how exactly this can be done? So this is where the generative AI is coming into the picture. So where this can be done it in a hour by giving the differentiates between what is the older policies, what is the newer one, what exactly can be given the differentiation. So that can be given as a assistance to the administrators to look into that, to review into that particular matters. And other than that, what I can say that basically query response and also the knowledge retrieval. This is also another important factor everyone has to look into it. Like when
Mhm.
patients or any staffs have any administrative queries or anything related to that, just by giving that well trained generative model can answer the few immediate queries, so they don't have to wait for long wait or queue. They don't have to wait for the doctors to answer for these small things. They don't have to wait for that. And also for audit and compliance, of course, so that also works well with the generative AI.
Absolutely.
Yeah.
Absolutely.
So
Those are
this
wonderful thoughts. And I typically, yeah, sorry, go ahead, please. Complete your thought.
yes, so basically it helps to bridge the data and the decision making. So basically whatever we are trying to do, but it's about data driven decision making that we are trying to move towards that. So that's how it helps the generative AI. That's what I want to say.
Absolutely. Absolutely. I completely align with your thought. And one good point which you brought out is when we have technology intervention or transformation coming into a specifically in healthcare system. I'm not an expert into other or don't have much knowledge about the other sectors or the other domains, but specifically based on my expertise, experience in healthcare system, I've seen like technology is here not to replace but kind to augment the human capability. That's where we say it's not a decision administration or decision making system, it's kind of a decision support system. So
Yes.
the end maker or the end decision maker, these are the actual human elements would
Yeah.
take the AI, the gen AI, they are aiding and augmenting the human capability to make those decisions. And you also talked about the time management, specifically these mundane jobs which can automatically be transferred across to AI, the technology who can execute.
Yeah.
So, asking like probably going a little bit more detail into that. So, what do you think from your perspective? How can decision support system, which is powered by Gen AI, by AI on a whole, it can help? I'm talking a little bit further away from the direct administrative systems, which are tangible to the end goals or the patients. I'm talking here about how the operations kind of gets affected in the overall healthcare administrative landscape. We are talking about resource allocation. We are talking
Yes.
about workflow optimization.
Yeah.
There is another aspect which you rightly pointed about, the HIPAA, the GDPR, which also monitor the fraud detection, the fraud waste. How do you think these are getting impacted? How is Gen AI and AI helping across these areas, operational areas of healthcare administration and healthcare platforms?
So that's really a game changing question. I can say that actually this is a very important question. Also, we have to look into it. So the decision support system. Actually, what exactly it's turning the complex data whatever we are having,
Mhm.
when it look into the overall healthcare, it's all complex information only we are having. If a random person, if someone and coming and saying that it is really hard to get what exactly can be done, what kind of action I can take from that. So that is where
Mhm.
this decision support is required. So it turns the complex data into an actionable insights that will give. So the best example I can say that resource allocation, as you mentioned, that resource allocation, that is a really hectic task for any administrator that they are working on, especially during the outbreaks or any seasonal trends or any flow inflow patterns are suddenly increasing or decreasing. So in that way, how exactly this can be supportive to the healthcare informaticians, how exactly it works for the administrators. So that is where the decision support system will help you to give the predict the outbreaks or predict how exactly the inflow system and the beds or what exactly the resources required for this particular period. So these can also be identified because of the decision support system. And next, workflow
Mhm.
optimization. Actually, it will give the I try to identify the what are the bottlenecks. It will try to map the bottlenecks of the process, which exactly it's slowing down. For example,
Mhm.
what exactly the discharge process is happening going slow because of the lab report, or what are the other causes it's happening, why exactly it's slowing
Got
down. So that differences can be identified through the workflow optimization and this fraud detection. Actually, this is a very important thing because currently for the insurance clients or any, because it's also a matter about the money and also the reputation also, it requires
Mhm.
related to that. So that patterns can be identified through the anomaly detection that can be done by data drifting, through the continuous monitoring through the drifting we can identify it, and like this and all. So basically, as I told you from the before, this try to augment the data driven decisions. That's what it will try to help when the
Absolutely.
decision support system, when we try to implement into this. So basically, what exactly is happening when I am whenever the problem is happening, by the time when we try to react,
Mhm.
instead of that, if we having any proactive strategy, so then that will be the best. That
Mhm.
proactive strategy is the decision support system. So instead of reactionable thing, we can go with the proactive
Mhm.
strategy. So this decision support system will help you to go ahead with that, uh, the decision support system, which will cover.
Absolutely. Those are wonderful thoughts that you talked about the proactive strategy rather than the reactive approach. We faced that challenge during the pandemic, the COVID pandemic. The entire globe, governments and organizations across the globe, they were not really prepared for such a level of pandemic. We
Yes.
saw the situation, we saw the mayhem which it caused. So that's where probably utilizing it was more of a reactive from the vaccination approach to the administration to the overall management. It's simple thing like hospital bed management, patient intake management, the diagnosis initial, the remote diagnosis, telehealth, all these aspects did come into the picture. And we realize as human beings, although we have the technology at hand, but how limited we are in terms of implementation when we are reactive in our approach. That's where those are wonderful thoughts which you mentioned about being proactive in our approach. But one thing which kind of brings a question when we are talking about approach in of utilizing healthcare advanced technology. Specifically, the subject of our discussion is AI, Gen AI, AI based model, etc. for administrative tasks. We
Yeah.
also talk about, because this is dealing with the life and death situation of our patients who are the end users of the technology or the recipient of this technology. So we also talk about accuracy, we talk about consistency, we talk about fairness. So from your experience in terms of deploying these utilizable AI models in healthcare systems, uh, where the stakes are really high because we are talking about the
Yes.
health of the patients. So what do you think? How do you validate the AI models for these typical areas before its implementation and deployment?
Yes, this really, whenever when we start with that any hospital clinical decision support system, these are the first things that we have to. The validation is the major part that is actually we have to deal with. First, when you told about the accuracy, how exactly we can start with the accuracy, how exactly we can measure our accuracy. So that
Mhm.
initially we can say that we can try with some benchmark model outputs or some historical with the historical data, and how exactly that recommendations has given with that benchmark data set. So that as an initial prototype that we can take that, and also we can take with the live information, and we can have the deviation, how exactly this is deviating with the benchmark. So that is the one way that we can measure our accuracy. That is the very easy, and also that we can also check the operational consequences, how exactly it works. And fairness is actually it's needed, because there should not be any bias towards with the departments, because hospital contains the diverse departments, the staffs are there, patient groups are there, and the even the small bias will lead to the very bad performance, and whatever we are looking, as you said,
Consequences.
that
Yep.
it's human lives are in stakes. So
Mhm.
it will lead to the unfair recommendations, it will lead to. So what exactly we can do, that we can actually divide into and subgroups, and
Mhm.
till no group we have to do that, identify that any advantage or disadvantage, there should not be anything between these subgroups. So as per that, we have to do the pilot testing across the subgroups, we have to do that. So in that way, that fairness can be, I think, that can be considered. So that's what my thought about this fairness. And
Okay.
very important is about the consistency. And this is a one interesting, I can say that every people, AI practitioners, what exactly they are
Mhm.
doing. All AI practitioners want their model to work, want their
Okay.
model to be more accurate and work. And they're not looking into about the data, how exactly the data is working. So that's the thing. So this is actually, the study is given by the, interestingly, this is given by the Google research team. The author named Nithya Samasivan, I told that author group. So how they, what they exactly
Okay.
they are trying to say, 93 percentage of the AI practitioners, they are having the one or
Mhm.
more data cascades, data cascades.
Okay.
So that is
Got it.
compounding, and then it is leading to the technical debt. So the technical
Mhm.
debt actually is the, it's kind of a financial debt over the, it's kind of, you can say that silent failures in the any administrative systems, especially the people who are in the AI, they are trying to look into that. So how this will create the messy pipelines over the time, there is no point of return back, that only it will create this data cascades. So where exactly
Mhm.
this can be done, there is a poorly managed data. The what exactly these, what kind of data is required, and what is the quality of data is needed. So those things are actually as missing out over here. So that if you try to focus on the quality of data, so then by the time, always that data cascade will be there, but it should not be like
Mhm.
no point of return, it should not be go over to that particular point. So each and every time, that should be always in that feedback loop to check about our data quality. So in that way, that consistency and this can be maintained with that particular one. So that's what, during my experience, I realized that. Yeah.
That's thank you so much for your thoughts. I kind of learned something new in your response about data cascade, technical depths. Probably give me some cue to go research more into that and learn more about that. But I kind of I totally align with your thoughts on data cascading, because when we are talking about integrating new tools, new technology, specifically transformational technology such as AI decision support system, into
Yes.
any healthcare administrative platforms or healthcare administrative system, data becomes a very, very important aspect. And
Yes.
when you talk about data cascading and kind of it kind of overriding the decision making system, sometimes it's kind of creeping into the biased decision making. And then
Yeah.
because of completely you also talked about the technical debt, which kind of leads to a point of no return when we are into implementation of any of these decision making tools. That really kind of impacts, and that's where it becomes, specifically in healthcare systems,
Yes.
the subject about controls, where we have the human in the loop checkpoints, we have the mandatory rational evaluations,
Yes.
the risk assessment layers, etc., which comes into the picture. So and when we as kind of people who are part of the technology integration between the end users or the healthcare payers, providers, and utilizing of new advanced technologies such as AI decision support tools, the architecture, the overall uh, EHRs, etc., take precedence and how we really implement. So I want to understand what was your advice. You have been into for a long time. You have been into the field of AI and research into the long time. As an implementer, or as probably a architecture designer of a typical healthcare based AI decision support system, what is your advice of integrating it into the into the existing system? Like, there are people are working on the existing legacy systems. When you are bringing some change, pardon me, and then you have to, it's kind of not a big bang approach where we replace the entire system overnight.
Yeah.
We typically go in terms of integrating and amalgamating the current system, the legacy system with the new advanced technology. So, what is your advice? How do we proceed into this kind of a phased integration, or a you can say an intelligent integration of this AI decision support systems into healthcare platforms?
Yes, as you said that existing system which contains the EHR and everything, they are having already, and now they are have to create a AI decision supports tool, decision recommendation system. They are looking for it. So basically, it involves reports and imaging. So basically, it's a patient centric mode. When I am trying to implement the AI decision support tool, it's full of patient centric mode that we are looking into it. So obviously it will give the image, and also the reports and everything as involved in this particular one, billing, insurance, everything as involved in this particular decision support tool. So first, I always try to understand the workflow before integration. I try to map out how exactly the things, who approves the clients, and how these schedules are happening, and how these reports are drafted, and how we can identify that how exactly we can identify where exactly this augmentation is required, whether this augmentation is required for the for images or generating the report, and where exactly this AI augmentation required, and what are the pipelines we have to create for that. So one example I can say that for generative AI module, policy updates or generate client summaries, or any final review kind of, how exactly this, who is the person who is going to review it, and these kind of things, first we have to clear with the initial setups how exactly we are going with that. And second and very important one is about the technical interoperability. So this is a very
Mm.
important key that we can say that, because it's involves with EHR and ERP systems or client platforms, whatever that pharmaceutical informations and everything. And basically this required the perfect ETL system. So that is extraction, transaction,
Absolutely.
loading system. This always required, because that is where, because AI needs a clean, normalized and standardized data. It's required, and because of this also we can also avoid the data cascading also. I mean, when we try to implement with the ETL systems, and this is the very initial step towards the data cascading problem and these things. And next one is gradual deployment with the pilot testing, that we can say that, as I told you, the pilot testing
Mm.
actually will helps you to monitor with the subgroups, and it's aligned with the fairness when we try to do the pilot testing. And you also mentioned about the human in the loop, that is there, that checkpoints that we have to involve the
True.
HITL checkpoints. So we can check that where exactly, why this, we cannot fully trust on the AI also. Something is AI is recommending, and the administrator is fully cannot follow that by saying that okay, it is recommending, I'm just allocating this resource. They have to think that why exactly it is suggesting that. So at least that their part has to have to think that whether this suggestion is correct or not correct, and why it is suggesting in that way. Once this understanding in that human in the loop, that has to be there. That's what it's very important for implementing overall integration, that actually this feedback loop is very important.
Absolutely.
And yes. So next, continuous learning, data drifting. I told that if there is any
Mm.
changes in the, any changes that we have identified with the updations, or something is happening, or some anomalies are happening. So by the time it has to recommend us, this is what happening here currently.
Mm.
So that's can be, which will help, these kind of loops and these kind of feedbacks will help us to give the successful integration overall, decision support system with the existing system which they are having currently. Yeah,
Absolutely. Wonderful thoughts on that. I wish I have one more session with you where we can exclusively talk about interoperability in healthcare.
definitely.
We have seen the growth of these monitoring tools, the devices, etc., with the direct feed into the healthcare data management, and how it really helps in real time decision making systems as well.
Yeah.
where the Genia and the AI-based tools are really helping and augmenting the human capability. But I will pick up another pointer which you mentioned about patient centricity. As we discussed initially, everything here we are talking about patient health, patient
Yeah.
lives, and the PHI, the patient health information, and all the entire system is completely surrounded and made around. To end of the goal is to eventually the patients, they benefit from the technology. They kind of get the best services, the best outcomes whenever the implementation of any advanced technology, any new tools, anything which is and specifically something like Gen AI based decision making, where they pick up the data from the cloud. They utilize the historical data, they pick up the patient's health history, and then kind of create a diagnosis outcomes, kind of a report generations for the decision maker, the physicians, the healthcare administrators, the nurses, the practitioners, to take the call. But when we talk about implementation about these new technologies, the advanced technologies which utilize the data, there is some concern, and specifically that's one of the bottlenecks or hindrances of specifically the emerging organizations, whether they want to invest into the technology at this point of time, whether they want to hold back. And then they also know there are the outcomes and the implications if there is some any challenges or any mishaps during the implementation or integration. So if we talk about some of the biggest things which we talk about, the ethic risk whenever we apply Gen AI or AI based decision making into healthcare administration. So we are talking about the data privacy, the misuse, the automation biases. We talked you talked about trust based approach. There was another aspect which I discussed about in one of my research paper on and ethical AI, about the hallucination and the accountability. Who is the one who is accountable whenever the system fails, whenever the AI based decision making gives the wrong diagnosis, which can lead to kind of emergency situations related to the patient's health. So what is your thought process? What are these biggest ethical regulatory challenges, etc., which has to be considered, which has to be taken into kind of uh, a major centralized, you can say, your consideration whenever we apply a Gen AI or AI based decision making in healthcare administration? Your thoughts on that, please.
Yes. So actually, when it comes to healthcare administration, when I talk about healthcare, I mean that risk, data privacy, it's really a very large topic, but I will try to bring down in few simple steps. Okay. So, so basically, it's all about the data. And when we talk about, when you mentioned about, it's about the data, decision making, and the accountability. Who is going to take in charge of that? That accountability that
Mhm.
is matters. So first, data privacy and security, as you told that, very important that preserving our, securing our patients' information, like patient demographics, what are their billing records, what exactly their scheduling details, and it should not leaking anywhere. As per that, as you told that HIPAA and GDPR and local healthcare laws, we cannot, it should not go outside. We have to give that much
Mhm.
security towards our healthcare administration system. So how exactly
Absolutely.
this generative AI models, I mean, so consider that, as you also mentioned, that in case if it is come to the cloud systems, we have to be very carefully. This things has to be very handled very carefully. It should not expose much. Like you can also give that instead of whenever we are trying to use some anonymous, some alternate ID. There are a lot of security imaging this. Data for forging and these things are happening, so this
Mhm.
can be can be carefully handled when it comes to the sensitive information with that. And basically, as I told you in the previous also, there are a lot of misuse of AI outputs are happening.
True.
So whatever chat gpt gives, that just the people believe that this is what this is the, I'm just going with that. Okay, so that is actually the problem of the current the problem that we are all over relying on the AI. That's what happening currently. So it should not
Mhm.
be like that. Always, if there is any anything is there, you have to look into that what exactly the problem is happening. It's always, it leads to the bias only. If I'm
True.
everything, if I'm saying okay, then always it leads to the bias happening will be there. So those kind of poor decisions can be avoided by, proper citing is required when it comes to the that is also has to be taken care. And next, bios, as I told that, like sometimes when it comes to budget or schedules or something related to that, it's happening, it's lead to the systematic errors may happen, that bias will happen. And also it is very dangerous to the patients. If it is dosage or something is there, it will consider that patients having the weight of 60 kg and the dosage recommended would be like 2 gram or something
Mm.
like that. And what if the mistaken has happened mistakenly, if you entered 120 kg of the patient's weight, and the
Absolutely.
dosage recommendation will be going high. So this kind of automation bias will happen. This has to be looked into it.
Mhm.
And very important thing is about the transparency is required in this particular healthcare that is needed actually. So what kind of transparency I am trying to say is like resource allocation,
Mhm.
staff, and policy, and what is the ethical deployment. Clear documentation is required. What exactly the clear documentation is like? Like exchanges, message formats, whatever we are saying, that HL7, XL12. So
True.
these kind of things should be, these documentation should be very clear to all the nurses and staffs. They should be needed. They need that transparency. What exactly, they should not run behind what is this code, what exactly it's happening. So this really very helpful when it comes to a decision making. This will be needed. So I think this can be mitigated by the strong governance of the
Mhm.
administration from the healthcare administrator or health informaticians. So they are the playing major roles in conveying all these things. And obviously, from the beginning, HITL is required, human in the loops checkpoints is required, and regular auditing is required, compliance is required, and transparent documentation. There should not be any bias documentation is should not be needed. So these will helps to help the policy, I mean the people who want to go for the decision support system, if they are considered all these factors in the mind. And when you try to develop the system, then it will be very, it won't be biased, and also it will be very useful patient centric decision support system that we can create. So that's my thought on this
Absolutely.
particular one.
Thanks for sharing those ideas. And typically, you got very brought in very valid points. Whenever you bring in technology, one of the major aspects is the change management, and then to help implement and kind of manage the overall change management process, we need to have strong governance, training. Whenever we are bringing in technology, specifically, we are talking about the healthcare system. People, again, no bias in terms of my response here, but we have seen typically people in the medical world, they are too used to. They have so much knowledge. First of all, they have so much experience. So sometimes it becomes difficult to overcome that hindrances in accepting the new technology, whether these AI based tools, data based tools, which kind of help them support them. The training becomes a really, really big and major aspects whenever we talk. We had, as part of my organization, we implemented an automation for the claims processing system, OGA. We had a tough time for almost 3 months convincing the people like this technology is going to help you speed up the process. There was a huge challenge. They were always countering us. They were saying, no, we have been doing the work for so many years. People had experience 35, almost 40 years working on the same processes, but they never wanted to change.
Uh,
And then other
this is
thing which
the
you talked
biggest challenge actually in
about
the for the healthcare informaticians actually.
Hmm.
So the people
Absolutely,
who
absolutely.
are, 15, 20 years, they used to the system, and suddenly you are
Hmm.
saying that now this system will speed up, and this is going to be a very big challenge for them because they are very used
True,
to the
true.
system, and suddenly you are asking to change. And this is
Hmm.
where in healthcare informatics, what actually we try to do is it's about the training and telling them, bringing them. I think you already did that, all this process, like training
True.
them what are the advantages and disadvantages that we when we try to say, and keeping, we should not introduce to all the groups. First of all, we have to
Hmm.
introduce to subgroups. So that's
No,
that,
absolutely.
because when you try to introduce to larger groups and immediate change in overall healthcare system, that also it will affect,
Does
that
not
new
work.
system will affect your older system, so that won't give the
Hmm.
perfect strategy. So first we have to introduce in a small groups, and then we
Absolutely.
have to get the feedback, and then moving to the next group. So then in that way it will, the implementation would be more smoother
Hmm.
to the people to the stakeholders who are working over there in that, I think.
No, absolutely. You talked about the phased and the pilot approach, which kind of really makes sense whenever you're talking about transformation or tools based or technology based transformation in healthcare administrative system. In fact, one of the major hospitals where we implemented AI based decision making tools as well for their authorizations, their claims management systems, their appeals and grievances systems. They changed my role for 3 months, saying you move away from delivery and take the role of change manager, change management implementation. So, like for
Oh,
3 months, I was completely working with the medical directors. I was working with the people on the ground, the people who are doing the claims adjudication, the actual physicians and the doctors who were part or involved in the healthcare administration of that hospital. It was a wonderful learning experience, but it really gave me some insight, like, yeah, how big is training, change management, and convincing people to accept
bringing
the
together
technology.
everyone to the same point, that is really a
Absolutely,
good
absolutely.
that you
Yeah.
did actually.
That is something which I am very confident. Whether we talk about next 50 years or next 500 years, the human element in the healthcare overall system will can never be taken off. It always will be there. A patient would, as a patient, I would not like to speak to a robot face. I would like to see a doctor when I even when I'm having a telehealth services provided to me via third party screen or something, a remote screen services. So that's what is important. Dr. Nandini, wonderful thoughts which you have shared. I'll come back to your area of interest and where you have your expertise and the area. So coming back to academics, you are assistant professor with Symbiosis Institute of Technology.
Yes.
From the academic vantage points, and you have been a researcher for so many years. So
Yes.
what do you think when we are talking about Gen AI, AI based technology, and advanced technology really impacting healthcare systems, not only in clinical way but also in the non-clinical aspects, administrative, operational aspects? What are the gaps in the research see, and what areas so that this specifically, because AI healthcare is an ever evolving uh, domain and landscape whenever the technology impacts it. So there is always be continuous research, ongoing research in how the end goal or the patient centricity, the patient experience can be improved. So what are your thoughts? What are the current gaps and how can be improved? What areas need more attention to perk up this area?
Actually, there are a lot of gaps actually it's there, and now currently also there people are trying to the translational decision support system, the people who are trying to go with that decision support system. First thing I feel
Hmm.
like the people need to understand the difference. It's not, whenever it comes to the physical infrastructure like hardware or software, I think the perspective should be it's not for software company, it should be healthcare setup is entirely different. Healthcare IT setup is entirely different. That understanding has to be there. That is the one thing the people need to understand about that. And when it comes to that operational data quality or standardization, I feel like the data is a bit messy and also a bit fragmented, I can say that,
True.
or inconsistent, that is always there in the health data. And always very limited amount of data set is available, EHR logs or whatever we are trying to bring out when it comes to data and AI. And next,
Mm.
explainability. Yes, currently all the research is currently is working on the explainability, but when it comes to administrative AI, not much as developed. I
True.
mean, it's there, but still it should be more improved. It's needed because administrative is actually an we can say that, as I told you before also, it's an invisible workload is more under the administration.
We are
So for that also,
we are the poor child
yeah.
of the overall healthcare landscape, right? The non-clinical aspects.
Yeah. So that's the thing. So that's actually needed more explainability is required over that. And also I talked about that automation bias and also human AI collaboration is required, and these things has to be taken care, and over relying on the that can be avoided, to the AI that can be avoided. And policy document and automation, like there is always hallucination will be there whenever it is generating some report. Always when it comes to any llama or something, always there will be hallucination detection or risk mitigation. Some problem might be occur. That is the very biggest gap that I can see when it comes to generating the report. We can say that. And also monitoring has to be more continuous. Sometimes it will be missing,
True.
the checkpoints are something missing. And the technical debt which I told about, that is very we have to look into that factor very carefully from the beginning, so that a lot of technical, a lot of things that can be avoided in the later stage. So that is the very important factor that we have to consider.
Mhm.
And ethical and these things has to be updated as soon as in the government, and whatever the alliance is happening, that your data and this government data has to be aligned properly. We always have to keep checking that particular points. So I think these things has to be considered. These are all a bit missing, and this can be improvised in a time. And definitely healthcare is going to be not, as you told, that it is not going to be like 5 or 6 years or 10 years. It's always will be
True.
there with human intervention. Always human will be there as a decision maker, because as a human we don't want AI or any robot to assist us. So always with human touch always we required. And even as you told that telehealth, when someone is seeing me and saying that I'm having a fever, okay, you're having a fever, take this medicine, so that is not applicable. Someone want to check me and how exactly this fever is there, and someone want to check the temperature, and these things has to be taken care. So always that human touch, and with the decision making and everything will be involved, and this is going to be for over the decades. And each and every time the new technology, definitely it's going to be there a lot, and all these problems also will be going to this hallucination, and these things also will be sorting out soon. That's what I believe.
Mm.
In future we are going to get a very good decision support tool, and it would be more patient centric. And the final note I would like to talk about that PHR,
Mhm.
that is personal health record. I mean, we all know about the EHR,
Mhm.
electronic health record, but now how exactly our future is going to be when we try to concentrate about the PHR,
Okay.
that is personalized health record. So when we try to give about our individual data is aligning, when it's aligning with the hospital systems, and then everything will be, because now what is happening here, whenever I fall sick, then I will go to the
True.
hospital, but I'm not going to check Even the 20 years, even 20 years old young persons are getting the diabetes or heart attack, or some problems are
Mhm.
happening. So why exactly? Because we all having one thought, like after 40 years of age I can do full health checkup, but it is not exactly working in that way. What if I'm having the personal health record from the young age? If I'm trying to devise from the, from my young age, it will be very easy. And my own, if I'm creating my own health data, that is the very golden data that we are trying to create. And also it will support the clinical decision support more. It will play a vital role, I think so. Yeah.
Nice thoughts on that, and specifically touching upon the aspects of PHR. In fact, I have read about PHR and how PHR kind of aids to PHP, like the personal health plans, which the systems are helping develop for individual patients. As you rightly mentioned, like people at young age, they are getting affected by these cardiovascular diseases, the diabetes and other diseases which we always used to associate it with people anyone above 40 or 60 years of age. Everyone is getting impacted, so it's very important to have like your customized health plans created with your doctor, with your physicians, with your primary care at the beginning. But thank you so much for sharing those thoughts with us, Dr. Nandini. I'll just have one final question. Uh, Kind of on a
Yeah.
lighter note, we talked about the human centricity, patient centricity. We talked about human in the loop, but we specifically talked about the doctors, the physicians, the nurses who are providing the tangible care to the patients. People like you and me who are not directly do not have the medical background, but we are still serving the healthcare ecosystem from the automation perspective, from the technology advancement perspective. Do you see both of us in the industry in the next 5 years or 10 years, or do we see our role being completely replaced by the AI based technology?
No, we will be always there, because we are the person who is communicating from, from all kind of hierarchical background.
Great.
We are communicating because we need that, nurse intervention,
Mhm.
and we are looking into that doctor's intervention. I mean, we are actually talking with all the people collectively, and then we are trying to create a system that actually require for the system. So now there is another role that is going to be there, like healthcare
Mhm.
informaticians. So that role is going to take another, for next years, that role is going to be
No,
there
absolutely.
in the industry. So the people might be looking for healthcare informaticians. So I think already in US it's already
True,
there.
true.
In future it will be more. The people will be looking for it
So
actually.
that's
So we are always be there.
that's an assuring response because most of our audience are maybe, or I'm not say are, but maybe from the non-medical background who are more into implementing and advancing technology in the healthcare systems. So it's assuring for them. Dr. Nandini, thank you so much for your time on a Saturday evening, helping us with your
Yeah.
thoughts, sharing your expertise, sharing your ideas, and showing us what exactly goes into when we have a collaboration of advanced healthcare technologies like the Gen AI into the human in the loop aspects of healthcare administrative system, where we talk about decision support systems and the decision making tools. Thank you so much for coming on our podcast. We were really thrilled to have you and get your thought process and ideas. I'll probably look forward to interacting with you in future and collaborating with you in future on your researches and other aspects as well, where we can work together and
Definitely.
advancing the systems.
Definitely. Thank you so much, Fadin, for introducing this podcast. And actually, I also talking with you, I also gained a lot of information how exactly going over there and how exactly you worked on this particular one. Definitely, I will also looking into that more research towards that. We can work on that, and we will do some research also related to that.
Absolutely. Sure.
Yes.
Thank you so much. And
Yeah.
you have a wonderful rest of your